Do you have depression or anxiety? Or a better question might be, do you know anybody who's currently using antidepressants or anti-anxiety medication to get through their day-to-day life? Hello everybody, my name is Caleb, and I'm a psychology major here at Cape Fear. I'm planning to transfer to UNCW to study psychiatry, and I hope one day to have a doctorate in psychiatry and be able to help heal people. So today I'd like to discuss with you guys some of the important aspects to antidepressants and anti-anxiety medications, and I'd like to discuss how they affect us, the individual who is consuming them, as well as the physician and the family members of those who are supporting it. So antidepressants and anti-anxiety medications are some of the most commonly prescribed medications in the nation. I believe most people are prescribed these medications prematurely because it's the easiest and fastest route to healing. I believe many psychiatrists may not spend the time that they need to with clients when it comes to depression and anxiety, and I feel that medication is just something easy that they can kind of throw at their patient, say, here, take this, you'll be healed. But I feel that real healing needs to come much deeper than that. I believe that real healing comes from finding the root cause and healing from there. About 13% of adults, 18 and over, consume some form of antidepressant on a regular basis. Antidepressants seem to increase with age, so as people get older, they tend to become depressed, I assume, and this is what causes that increase in antidepressant usage. So if you look at when depression is most prevalent, there's a couple different spikes in what age you are. So for example, ages 18 to 21 about, there's usually a spike. People tend to experience depression around that time, most likely due to all of the changes that they're experiencing in that time. You also see a spike around 40, mid-40s, I believe, early 50s. There's a spike in depression, and then I believe there might be one more around there somewhere. And on top of that, women tend to have a higher rate of antidepressant usage than men do. So I don't know how much this speaks as to depression rates in men and women, but it at least speaks to the fact that women tend to search for healing when it comes to mental health a little bit more than men probably. Anti-anxiety use is very similar. There's about 20 people in the U.S. One out of every 20 people in the U.S. who are currently using anti-anxiety medication, and 33% of people experience an anxiety disorder at least once in their lifetime. So when I say anxiety disorder, I'm not talking about just having a spur of anxiety that lasts for a week because of events going on or something like that. An anxiety disorder has to meet specific criteria that's written out in the Diagnostic and Statistical Manual for psychiatrists. And this includes an extensive level of anxiety that lasts at least 6 months, as well as causing disturbances and some other criteria that they need to meet there. Antidepressant side effects are there's a lot of prevalent antidepressant side effects. The most common ones, which people are usually accustomed to or understand, is dizziness, diarrhea, weakness, stomach pain, dry mouth, sexual disturbances in some of them. But most people are not aware of some of the more severe ones. So, for example, antidepressants, when used usually in the first 2 weeks of treatment with them, there's an increase in depression. So, during the first 2 weeks, people tend to experience more severe suicidal thoughts and more severe depression. And that's why psychiatrists are supposed to watch over their clients for those first 2 to 3 weeks and really ensure that they are in a safe environment and that they are okay during those first transition periods, getting onto the medication. But some of the worst side effects aside from that include irregular blood pressure, high cholesterol, dependency, confusion, anxiety, etc. So anti-anxiety side effects are very similar. This is because anti-anxiety medication is usually the same type of medication. It's either an SSRI or an SNRI. And these are selective serotonin reuptake inhibitors or selective norepinephrine reuptake inhibitors. So there is other types of medication aside from that, but these are the two most common ones. And they're going to focus on your serotonin levels and your adrenaline levels, as well as sometimes your dopamine levels, depending on the medication that you have. So again, my problem is not that these medications are bad, not that they're inherently bad at least. My problem is that they are being prematurely distributed to people because it's an easy thing to just kind of help heal them real quick. But I believe that there's a more humanitarian and natural pathway for treatment. And that brings me to my kind of solution and what I believe we can do to help heal these people, which rather than quickly just stick a Band-Aid on it, again, like sometimes it might be okay to use these medications. For example, if somebody's having horrible suicidal thoughts, like very extensive suicidal thoughts, and they need to be kind of stabilized quickly, I can see how these medications might help. Same thing when it comes to anxiety. If you have a strong panic disorder or something like that, where it is literally practically impossible for you to like go about your day, I completely understand where that medication might be appropriate. But I believe that true, deeper healing needs to come outside of just that medication. I believe that medication is more like a Band-Aid. So I believe true healing needs to start at the root. And for most people, so like myself included, I had depression for about 2 years, a little while back, which diagnosed me with persistent depression disorder. I will admit I did not go to a psychiatrist to get diagnosed, but being that I'm studying this and I understand what I've gone through, I believe that I would have been diagnosed with persistent depression disorder had I gone to a psychiatrist. But I, during that time, didn't realize what the problem is. And I believe most people, when they're depressed, they can't really identify why they're depressed. But that's why sometimes we need a separate pair of eyes to kind of look at our situation and help us dig and find the root to why that depression or anxiety is striking. So I believe first things first, we need to find the root. And then we need to start with lifestyle changes usually. Lifestyle changes are the biggest factors in depression and anxiety. And I believe that, for me, for example, I had to get rid of a lot of my social aspects. I had very detrimental social relations that were bringing me further and further down a rabbit hole of depression. I believe that something else that's really important to push is interrelational support and understanding in that aspect. So having family members, having close friends who are supportive, understanding, and genuine, very genuine, sympathetic people. I believe it's important to have that around, have that support group. And aside from this, I believe that there's also some natural supplements that we can take. Aside from medications, I believe there's natural supplements which include GABA, SAMe, potentially 5-HTP, and potentially vitamin B12. So these might affect different people differently, and sometimes they might not be appropriate. But these are, like GABA, for example, is a neurotransmitter that's going to help regulate those levels, and it's going to help you kind of uplift your mood, create some level of euphoria. So in conclusion, I believe the path to healing for depression doesn't require prescribed medication. I believe that it needs to come from a deeper place. And I believe that we need to recognize that there's other opportunities to healing, other pathways to healing than just medication. So overall, that's my conclusion, and I hope that I've persuaded some of you to do some research further into the medications that you're taking, and I hope that I've persuaded some of you to consider a natural pathway and a more sustained, permanent solution to depression and anxiety. Because something important that I like to say is that deep wounds need deep healing. You can't have a stab wound and throw a Band-Aid on it. You need to get in there and you need to do surgery to heal it so that it can sustain that healing long term. But anyway, I wish you guys the best. I wish you guys a sustained, healthy mental health. And I hope you guys have a phenomenal rest of your day.